Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And you can also visit the playlist. In the playlist, I have provided all the topics so far discussed in a very systematic order. It is quite convenient for the study. My dear friends, today we will discuss about a very small topic which we commonly come across in the OPD practice. Now we know that the metabolic disorders are one of the very important aspects in pediatric OPD because inborn errors of metabolism is quite common in pediatric practice, especially in the early part of the life. And we have got more than 216 so far identified metabolic disorders of inborn nature. So it is quite difficult to identify these inborn errors of metabolism. So whenever you have got a doubt about inborn errors of metabolism in OPD practice, how you can proceed? So that is very important. What are all the investigation that you go to identify the possible chances of metabolic disorders? Okay, so now when I talk about metabolic disorders, we have got metabolism of the glucose, we have got metabolism of the fat, we have got the metabolism of proteins. That is proteins, that is nothing but amino acids, so fats, which is nothing but fatty acid and glycerol, and about the carbohydrate, it is glucose. Now different enzymes which are responsible for the metabolic pathway of these end products of food like glucose, like acetyl-CoA, and also as amino acids. Okay, so different enzymes are required for their metabolism. We will not discuss it in later in detail. Now if there is absence of any of the intracellular enzyme or intermediate enzyme which is required for the different steps of this metabolic pathway, then it results in improper metabolism. That means metabolism pathway will be stopped in between, and as a result a toxic metabolite is formed. Okay, and that will be toxic to the body and it will cause so many problems. So that is how the metabolic problems start, especially inborn errors of metabolism. Now in the OPD practice, how easily we can identify this? Suppose if we have got a doubt that yes, this child has got maybe having some metabolic problem, how you can proceed? Okay, for that today I am giving a logarithm, so it is quite easy. Now whenever we talk about metabolic disorders, inborn errors of metabolism, basically we will have three important categories. One is organic acidemias, that is metabolic problems causing organic acidemias, inborn errors of metabolic problems leading to because of urea cycle defects, inborn errors of metabolism because of different amino acidopathies. Now we should remember these three things. So whenever we talk about inborn errors of metabolic disorders, either it may be an organic acidemic disorder, either it may be a urea cycle defect disorders, or either it may be the disorders related to amino acidopathies. Okay, so now how to proceed? Now when usually how a patient of a metabolic disorder comes to you, so usually he will come with the problems like poor feeding, okay, or he will have sudden vomiting, he will have diarrhea, patient will have lethargy, or patient may have convulsions, or sometimes patient may comes to you in the conditions of coma. If the metabolic disorder is little long standing, then patient may complain of mental retardation. Okay, if the patient is coming in the early infancy, there may be chance of progressive jaundice. Okay, early infancy, the progressive jaundice, pathological jaundice may be there, growth failure may be there, poor feeding may be there. So these are all the different things that helps you to identify the metabolic problems. In the later phase, again you will get a different set of symptoms. For example, enlargement of the liver, hepatomegaly, splenomegaly. Okay, then more importantly you will have change in the color of the urine and change in the color of the stool, and there is outbursting of some very peculiar smell from the body surface. See, these are some of the important symptoms which helps to identify the possibility of existence of a metabolic disorders. Okay, so some of the symptoms start at the earliest, some of the presentations start at the later part of the life. But when there is a poor feeding, poor weight gain, growth failure, mental retardation, hepatosplenomegaly, peculiar smell from the body, okay, peculiar color to the different color to the urine and different color to the stool, okay, mental retardations, sudden omitting which is coming in a periodic way, okay, omittings, diarrheas. So these things are considered as some of the common symptoms related to all types of metabolic problems. Now today we will have a logarithm so that we can identify some of the common things. Now, which particular metabolic problem identification requires a lot of workup. Okay, we have to work out a lot. Okay, but today only if you are able to suspect whether it is a organic acidemia, whether it is urea cycle defect, or whether it is amino acidopathies, this much is sufficient at the base level. Okay, how to do that? Suppose if you have got a metabolic disorder, any doubt of metabolic disorders, the first investigation that you have to do is plasma ammonia. Okay, first go for, this is the simplest approach, first go for plasma ammonia. Now, in many conditions, plasma ammonia is increased, that is suggestive of metabolic problems. But plasma ammonia may be also decreased or plasma ammonia may be normal. That does not rule out the metabolic problem. So therefore follow this particular sequence, that is very important. First go for plasma ammonia. Okay, plasma ammonia. Suppose you got plasma ammonia normal. So then the next step you go for a pH of the blood and blood HCO3 and CO2 level. Now this pH and CO2 and HCO3, CO2 and HCO3, both the things will going to increase the acidity. Okay, it causes acidemia in the blood. So that means in the second step, plasma ammonia you have done, take it as normal. Okay, for time being, take it as normal. Now the next step you go for pH of the blood, CO2, or you can say go for acidic substances in the blood. Now, if these acidic substances CO2, CH3 is also normal, okay, so it may be normal or it may be abnormal. If this pH, CO2, HCO3 is increased, that directly suggests that there is increase in the acidic substances. There is increase in the acidic substances. Something has been happening which actually increases in the acidic substances in the blood. Therefore, there is increased pH and the pH is acidic, and also there is a CO2, HO3 is added. In the next step, now you go for anion gap. Okay, now you go for the third investigation, anion gap. Now if plasma ammonia is normal, okay, blood pH etc. is that acidity is acidic substances are increased, plus anion gap is high anion gap is there, plus ions are more and negative ions are less. Suppose anion gap is more, then it is definitely indicative of acidosis, and the possibility of the metabolic disorder is organic acidemias. Okay, so the possibilities of organic acidemia. So one group of metabolic disorders we have already diagnosed. Go for plasma ammonia first. It may be normal or it may be abnormal. Then go for the acidic substance. Find out the pH of the blood. Then look into the acidic substances. If it is increased, okay, then go for the next investigation. So that is go for the anion gap. And in the anion gap, if you see that anion gap is increased, then it suggests that it is organic acidemias. Okay. Now suppose if the anion gap is normal, acidic substances are not there in the blood much. Okay. So it is almost all normal, but plasma ammonia, which you have done previously, that is increased. Increased plasma ammonia and anion gap is normal. Okay. So this suggests that the problem is there with the ammonia. Ammonia is produced from the nitrogenous wastes. So nitrogens will come from, we know that amino acids and all those things. Okay, so that disintegration of this or degradation of this nitrogenous waste takes place through the urea acid cycle, Krebs cycle. Okay, so therefore it suggests that this is something related to urea cycle defects. urea cycle defect. What is that? Normal anion gap and as well as high plasma ammonia. It suggests that there is a urea cycle defect. Third one is, if normal anion gap is normal, and also there is normal plasma ammonia, normal anion gap, but still you are suspecting a patient for some of the metabolic problems, symptoms are there, then if this finding is there on investigation, then most probably it is amino acidopathies, or even in case of galactosemia or amino acidopathies, you find this particular finding. Okay, now this is not the complete the workup for the metabolic disorders. At the OPD level, when you got a suspicion, for the time being, these are the investigation that you have to write. What is that? First, go for plasma ammonia. Plasma ammonia may be normal or it may be increased. Then you go for the identification of the acidic or acidosis. For that, you go look into the blood pH and the contents like CO2, SiO2, etc., SiO3, etc., bicarbonate ions, etc. Then you look into the anion gap. Okay, by looking into the anion gap, if it is high, no doubt acidity is increased, acidosis is there, so it is as organic acidemias. If normal anion gap is there, but plasma ammonia is increased, ammonia is from the urea cycle, therefore definitely it is some urea cycle defects. And third one is, anion gap is normal, but plasma ammonia is also normal, then it suggests amino acidopathies. Therefore, in the beginning I told, normal plasma ammonia is not will not rule out the possibility of other metabolic disorders. Okay, normal plasma ammonia, normal anion gap, then it is amino acidopathies. For that identification of which type of aminopathy, then amino acidopathy, we have to go for further workup. So this is about a very simple about the approach towards the metabolic disorders in pediatric practice whenever we face such problems in the OPD. Thank you very much. We will meet in the next class, and I hope you enjoy. And don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.